Hi there. The last year has been a hard time for many people for lots of reasons, but it has also been a hard time to be a provider of behavioral health and other medical services. My name is Brendan Reardon, and I'm the Senior Supervising Clinician with the Behavioral Health team at Pillars Community Health. In my work at this agency, I provide training and clinical supervision to many of the behavioral health staff, as well as caring for clients of my own. We know that the needs in our communities have increased, and at times providers may feel the weight of the world as very heavy on their shoulders. It has also been a hard time to share that weight with others due to our own isolation at times from our coworkers and other natural supports, particularly with so many people working from and staying at home. I understand how hard it can be, and I want to share with you some of the things that I have learned in my work to support other clinicians, some of which I have learned from them as we experience this together. I believe that play can be as important for adults as it is for children, and an essential part of our self-care. When I talk about self-care, I think of this as something to conceptualize individually through self-awareness, self-regulation, and self-efficacy. This is important in our fight against compassion fatigue. Compassion fatigue describes the experience of secondary stress, which is experienced by a provider in receiving the traumatic presentations of our clients and patients. This is more likely to come up when we identify with the trauma that they are sharing. And of course, this has been prominent during the pandemic. Many of us are experiencing serious stressors at the same time as our clients. We may have those reactions at other times to client material, but now we are in traumatic situations at the same time. Clinicians encounter a number of forms of occupational stress on a regular basis, and by understanding these stressors and what each of us needs to do to manage that stress, we can be more effective providers and lead a more balanced and healthy life. Self-care is not something to work into our free time, but we should consider this as a need for our practice. As one of our students recently said, self-compassion involves compassion directed inward. We stop to recognize and acknowledge our own suffering and wanting health for ourselves as a proactive behavior to better our own situations as well as those that we are treating or caring for. When we talk about big feelings, many of us find that it helps to deal with an emotion or manage our feelings when we can name it, like anxiety or anger. Identifying and expressing that feeling helps us begin to cope. To that end, grief is a word that many of us started to use earlier in the pandemic. Many of us have grieved people that we lost due to COVID-19, but also many of us grieved losing jobs, losing opportunities, and missing people that we did not get to see or visit due to our safety restrictions. But what comes next after grief? There may be something that we feel before satisfaction, something in between. Another feeling word, which has been coming up recently in response to the COVID-19 pandemic, is languishing. This describes a state in between your ideal, fully functional self and a depressed state, sort of in between. We may experience this as apathy or a kind of foggy, numbed state. There was a good article about this experience recently by Adam Grant, a professor of management and psychology at the Wharton School at the University of Pennsylvania. He wrote in the New York Times, "Languishing is a sense of stagnation and emptiness. It feels as if you're muddling through your days, looking at your life through a foggy windshield, and it might be the dominant emotion of 2021. So what do we do to address this feeling? There are two suggestions that he makes. One is to try to identify smaller tasks to address each day, rather than focus exclusively on larger projects. These smaller tasks and a sense of accomplishment help to increase our productive time with focus and a clear mind. This might seem counterintuitive when we're used to multitasking, but at times it is just what we need. Second, some tasks can be best managed with a longer period of focus, saving a 2-hour block of time in order to concentrate on one large project, with smaller things such as writing progress notes being reserved for our 10 or 15-minute opportunities. And what are some other strategies that we can talk about to help us cope? One of the most important is simply to breathe. Deep breathing can help you calm down and improve concentration. Throughout the day, take several deep, mindful breaths, especially when you're feeling anxious or stressed. In fact, it's important to practice that outside of when you're actually feeling anxious, just to get accustomed to the process and practice mindful breathing at other times of day. Also, eat healthy food. Bring healthy food to eat at work or cook for yourself when you're working from home to support healthy eating habits. Try not to eat a lot of sweets or consume more than your normal amount of caffeine or alcohol. Also, get sleep. Ensure that you get adequate sleep each night by practicing good sleep hygiene. Set the same sleep wake schedule. Avoid use of technology in the bedroom and schedule a relaxing bedtime routine. Get some sunshine during the day and try to limit your exercise, but practice it every day. Daily exercise should be a priority to help you handle stress and have the energy needed for strenuous days. I realize exercising at home can present challenges, and many of us had our routines interrupted by the closing of gyms and other facilities, but there are many free exercise videos available. Try something new. Take a walk or go on a hike. Even just a few minutes a day can have an impact. Also, remember to pace yourself. This pandemic needs to be fought at a slow and steady pace, like a marathon. Your clients, patients, and others important to you need you at your best. So keep yourself fueled with sleep, healthy food, energy, and a positive attitude. When you feel disconnected from supports at work, seek out connections in your professional and personal life. Also, make sure to take breaks. Plan and take short breaks during the day to stay calm, keep up your energy and your focus. Take a moment to go outside for fresh air, even in the rain, and plan some downtime to help you replenish emotionally and physically. Remember to read books or listen to music. And importantly, limit your time on social media and digesting the news. Be sure to make time also for creative activities such as drawing, writing, or playing an instrument. Set a structure to help you manage. The environment has changed over the year of the pandemic. So take time to reassess your needs at home and make little changes along the way. Focus on what you can control in the present and find ways to be grateful also. When you continue to struggle, remember to ask for help. You may have trouble focusing on daily activities or responsibilities. If you find that you're feeling helpless or hopeless, if you're becoming increasingly negative, it may be time to seek professional help for yourself too. Um, Make sure when you start to feel things like that to contact your employer and see if you have access to an EAP or employee assistance program if you'd like to speak with a professional for help. You might also choose to seek out services for yourself through your own insurance. Also, consider a community mental health center or a federally qualified health center, such as Pillars Community Health. Take care, and together we will get through this. Thank you.